Where's she at? She's sitting on the rail here.
No one calls us to give us good news. They call us because something bad is happening, and so they're in a crisis.
Are you okay?
We used to have a saying in law enforcement: ask, tell, make. When I ask you to do it, I'm going to tell you to do it, and I'm going to make you do it. On average, in a police academy in this country, they spend 60 hours or more learning how to shoot a gun, and they spend 8 on mental health and communication. We need to shift that.
We have invited our sheriffs, our chiefs, and our CEOs of community mental health to kick us off today to talk about the importance of the partnership and collaboration between mental health and law enforcement.
So Dana Lazenby, Eric Dodd, Sheriff Bouchard, Sheriff Washington, Chief White, Chief Zinzer, you can make your way up.
So this partnership is so critical because we know at any given moment a person who encounters law enforcement may be struggling with
all of
mental
us
health
has
crisis.
someone in our family down the line there, trust me, who suffers from mental illness. And I think it's amazing when you can bring the law enforcement community, our partners, to work along with us.
That is non-negotiable, it's not optional. We're in a state of crisis with mental health. We have spent too much time waiting for someone else to save us, and I'm so happy that we are proactively engaged in this. It's not an issue of if mental health will impact your agency. Mental health is impacting your agency right now.
Because I believe, and then as I do now, we need robust funding for mental health services, a wide array of services, and community partnerships that have the ability to connect those services with those that are in need and those also that are in an acute moment. We need to have more people in policy positions connect people that are in crisis with the services they need and then fund them.
Ernie was a police officer for 28 years, serving 26 of those years with the San Antonio Police Department, where he was a founding member of the Mental Health Unit. He has been featured on the Emmy Award-winning HBO documentary, Ernie and Joe Crisis Cops. He has also been featured in NBC's documentary, A Different Kind of Force. Welcome, Ernie Stevens.
Good morning. I would like to take the time to thank Oakland Community Health Network and the Detroit Wayne Integrated Health Network for inviting me to speak at your Michigan Crisis Intervention Team Conference. We as a community have finger agencies and organizations, but until we learn how to ball them together and collaborate, we will never be a best practice approach. What if everybody, every provider, every hospital that offers psych services, and every private provider would use this same system and put your psychiatric beds online so we know what's available in the city? It's working together as a community to help give them what they need. So to see private providers come together and provide this type of service, to me, was mind-blowing because it's never been done before. This is such an exciting time to be in law enforcement and social work. For far too long, we have been siloed, and now the need for the community is being heard loud and clear. It is time for us to ball up our fist and become an unstoppable force to help our community members.
Today we're here at the Michigan CIT Conference. CIT stands for Crisis Intervention Teams. So jointly with Oakland County, Detroit Wayne Integrated Health Network has sponsored and hosted this training together to bring awareness and information to our colleagues across the state on the importance of collaborating with law enforcement and behavioral health.
Welcome from Oakland Community Health Network. We are happy that you were able to join us here today for our conference. We hope that you enjoy and learn more about expanding and implementing your own CIT program.
So jointly we've trained over 1,500 individuals in Wayne County and Oakland County, and we're looking forward to training additional individuals.
Anyone in law enforcement who's going to interact with an individual who may be experiencing a crisis.
It's important because we're saving lives. When police encounter individuals in crisis, they now have the tools and resources to help that individual, not in that instance, but also beyond.
I just love the fact that we get to partner with our law enforcement team. You know, I think it's so important when you can have that within the community. You know, folks look to law enforcement as being a very important piece of, you know, just not only keeping the peace, but also being secure. And I think for the population that we serve, such a vulnerable population, folks come about those difficult times. And I think it's really great when you can have the mental health community come together with law enforcement to actually know when they encounter folks who we work with on a daily basis, how to deal with them. And so for my partner in Oakland, you know, for us here at Detroit Wayne, we just see this as a wonderful opportunity to bring folks together to do something that is great for the community.
Together.
At Detroit Wayne Integrated Health Network
and Oakland Community Health Network,
We're changing culture
and growing stronger together.